Hello everybody, Brian Glies from the Scott Insurance Agency. This particular video is going to be another video in the series for individual health insurance. Individual health insurance has never been important than the current times. There's a lot of people that are being laid off or losing group health insurance. One of the things that they want to know is what do I qualify for? I'm going to take you through how to determine that, and this is for those of you that like to do your homework or like to be in the know prior to our appointment. So we're here on the website HealthCare.gov, which is where we do everything. This is the opening page. We're going to go up here to the search bar and we're going to type in the word plan, P-L-A-N, and hit search. So the very first box that comes up is preview health plans and prices based on your income. Why based on your income? Because Obamacare or the healthcare marketplace, one of the things that it talks a lot about is the tax credits or subsidies that are available. So we're going to click on this box. We're going to supply them the zip code that we live in. The zip code encompasses 2 different counties. We're going to look at Warren County and click continue. Tell us about you and your household. Plan ID, we're just going to skip because we don't know the plan ID yet. Who's in your household? Are we looking for insurance for just you, or for you and your spouse, or you and your kids, or you and your entire family? For this particular example, I'm just going to do me and press continue. Age, 47. I'm a guy. Select any of these that may apply to you. You take a look at these. None of these are going to apply to me. I don't smoke. I'm not pregnant. I'm not a legal parent or guardian of a child under 19. Yes, I am, but we're going to pretend that I'm not. And I'm not eligible for Medicare or any other insurance through an employer, anything like that. So I'm going to put none of these. Continue. So I'm not going to add a spouse for this example. I'm not going to add a dependent for this example. Confirm. What do you think your household income will be in 2020? So this question is a mouthful, guys. So you're going to have income from a job, hopefully. Even if you're just applying for yourself, they do want the household income. So if you have a spouse, even though they're not going to be on the insurance, and they have household income, that needs to be counted. If you have rental homes that you're receiving income from, that needs to be counted. They're looking for that income on 2020. This is a topic of conversation that we spend a lot of time on when we're together because it's important. Now, just to show you how this thing works, I'm going to say that I make $30,000 for the year. Again, this is just as an example for me, an individual, only on the insurance, not worried about anybody else. So it says here that based on the income for the household information that I provided of just me, you may qualify for an estimated premium tax credit of $300 per month. So this is where the rubber meets the road. Now, if we get this wrong, if we input the wrong household income at the end of the year, it'll be reconciled when you do your taxes. And they'll either be a stick or a carrot. They'll either beat you with a stick because you made more money than you said you would, and they're going to take some of that money back via your tax refund, or they're going to give you a carrot and say you made less money than you did. We owed you a little bit more money. So now then we have the opportunity to view plans. View plans, it says help in comparing plans, kind of tells you how to use the website. You click next. Silver plans are the most popular plans, but we're going to say see all plans. And now where we're looking at everything. In Warren County, we have 2 choices. We have Cigna and we have Ambetter. This is going to change depending on the county that you live in. There's a button here that says filter plans. If we click that, we can look at only bronze plans, which are the cheapest. Silver plans, which most people do. It says you get extra savings if you pick a silver plan, or a gold plan, which would be like the Cadillacs. You can also come down here and select an insurance company. If I know I don't want Cigna for reasons that they don't take SSM doctors or whatever reasons, I can just look at Ambetter plans or vice versa. We're not going to worry about any of the filters right now. we're just going to go in and we're going to take this first one. So this first one is a Cigna Connect 7000. The deductible $7,000, maximum out of pocket. All of this stuff you need your decoder ring to figure out in most cases, and that's the reason why you're coming to us. But what I want to show you is estimated monthly premiums $128.95, including the $299.60 tax credit. So for any individual walking into my office, they would expect to pay $428.55 for this product. Due to the fact that I qualified for a tax subsidy of $299.60, I would only be paying $128.95. Now, the limited amount of information that is on the screen is not enough to figure out if this plan is going to work for you. So we click Plan Details. When we click Plan Details, we scroll down to Plan Documents, and Summary of Benefits is where you want to be. When we open up the Summary of Benefits, it takes us to an explanation of that plan, most of the time in English. It has actual sentences, words, and explanations why this matters, which is pretty fantastic. So we just scroll through this and we can look at a primary care physician as $60, a specialist, you have to pay everything until you meet your deductible, and then it's 50-50. So yeah, this still isn't clear English either. This is one of the reasons why you're coming to us, because we have the decoder ring. But this information, I think, can help you determine or at least narrow the scope of what you're looking for. So if we go back to Medicare, I do a lot of Medicare. If we go back to HealthCare.gov and we go back and we just look at the plans, we can scroll down and it goes from least expensive to most expensive. Don't let me make you dizzy as I scroll through here. I just want to get to the bottom of the page. So there's 3 pages of plans. The plan at the top of the first page is going to be the least expensive plan. The plan at the bottom of the 3rd page, don't let me make you dizzy. So this is page 2, go into 3rd page. Plan at the bottom of the 3rd page is the most expensive plan. Why is it the most expensive plan? Because it has a lower deductible and a lower out-of-pocket. Again, you can click on the plan details, scroll down to plan documents, summary of benefits is what I like to look at with my clients. You can print this and you can review this. So again, guys, this is for all of you that like to do your homework prior to the meeting. We're going to be taking you through these exact slides that we're going through, except we're going to explain them, we're going to stop, we're going to pause, we're going to talk about the questions that you have, and we're going to go from there. So HealthCare.gov is where it all starts. If you are the type that likes to do your homework, some people will even come into my office and say, I've had the opportunity to look, this is the plan that I'm looking for, this is the subsidy that I believe I'm going to get, will you just confirm it all? So we went over a lot. I don't expect it to totally make sense, but this is the tools that we use to help you, and if you have the opportunity, I think it helps for you to be as educated as possible about what you're getting ready to buy before you come into the meeting, and it just helps the reinforcement that we give the information for everything to kind of make sense and solidify. So thank you guys for your time and watching this video. If we can help you in any way, let us know. Bye-bye.